Hi, everyone. Welcome to the Kind Help Group podcast and YouTube channel. We have an amazing guest with us today, Dr. Laura McPeake, who is an emergency physician in Rhode Island. Welcome, Laura. She's going to tell us a little bit about her background.
So I'm Laura McPeake. I'm an emergency medicine physician in Rhode Island. I'm affiliated with Brown University and two hospitals here in Providence. And I'm also the director of physician wellness for our emergency medicine group.
And she's also my dear and lovely friend that I miss.
Oh. Yes. Come back.
No, we're not sending her back. Not now or ever. I'm keeping her now. So tell us how, in the midst of this COVID-19 crisis, how you've been doing, what it looks like over in Rhode Island.
I keep saying that I'm doing pretty well considering, which is a pretty low bar these days. But I think in Rhode Island, things are starting to amp up. We're definitely past the calm before the storm part. I would say on average, 50% or more of the people that I see are COVID related or COVID suspected patients. Our volume is overall down still. People are not coming to the emergency department unless they absolutely need to, which is really good. So we're not busy in terms of patient volume. However, because everything is shifting all the time and it's more arduous to kind of navigate patient interactions with all the personal protective gear and kind of new systems, it's still busy, but a different kind of busy. And our volume is overall now increasing from what it was a week or two ago. So that's both expected and also a little nerve-wracking for sure.
Yeah, and what are you seeing in terms of the kinds of patients that are coming in? Is it sort of all over the place, or just mostly the chronically ill and the older populations?
It's definitely a mix. We're seeing the kind of traditional believed, I mean, traditional sounds funny because it's a novel virus. We don't really know that much about it. We're sort of learning on the fly. So there are definitely high risk populations are coming in. But it is affecting, people of all different risk categories, so young and old. The higher risk populations are more severely affected on average, although we are seeing, a fair number of cases of people who are quite ill who are young. So that's hard.
What symptoms are they sort of presenting with? What's common right now?
Yeah, fever and body aches for sure. Respiratory symptoms, kind of the sore throat, cough. The most worrisome ones are the ones who are having significant trouble breathing or having low oxygen. And those are the people who often end up getting admitted to the hospital. People who are having just the other symptoms can often be discharged home with supportive care. And then, there are the strange case reports coming out of people with kind of hepatitis or pancreatitis, other GI manifestations like gastrointestinal manifestations of presumably the infection, some kind of neuro manifestations with stroke-like symptoms or different nerve palsies and things like that. So we are seeing some unusual presentations as things move on.
Are you seeing a lot of people coming over from New York and other more heavily affected states? Has that been an issue? I know the governor of Rhode Island has at one point I can't remember the details, had issued an order to stop people coming in from New York. What has that been like?
Yeah, there has been a fair amount of influx, understandably so. And the current recommendations are that people self-quarantine, which I think is reasonable. Our state troopers are stopping people at the border to make sure, from any state, to make sure that they know if they're coming into Rhode Island from another state, they need to self-quarantine. The same is true in Massachusetts has a similar rule. But a lot of people do have second homes in and around Rhode Island, and understandably are trying to escape to kind of a less population dense area. Although Rhode Island, New Jersey, and Puerto Rico are the most population dense places. So I think our governor has been appropriately restrictive on enforcing the physical distancing, because though we don't have the density that New York City has, we do have a high population density. So we are very at high risk of having very rapid spread throughout the community, and we are starting to see that that there's quite high community spread. I mean, the idea that you had to have traveled from a place or been exposed to someone is no longer a truism. I think, in any major city, but particularly here, that's noticeable.
What about, do you have enough supplies for yourself? I mean, do doctors have masks? Do you have everything you need at the hospital?
There is a shortage, which means that we're reusing in ways that the regulations keep changing. So that's confusing, especially for frontline providers. What we were initially told we had to do has now become much more dialed back. And that's probably safe based on what we know about the disease, but the problem is we don't know that much about the disease, and the real data won't be coming back for like a year or so. So people are very worried that things are being too relaxed in the face of scarcity, but there is scarcity. So there's only so much we can do. There's a lot of creativity in trying to help give people a sense of more security, but in a way that's standardized. And there are some bureaucratic loopholes that people are trying to jump through to be able to feel safe that they're protecting themselves. But really that also is an essential part of being able to protect their patients and their families. So, within the hospital, everyone's wearing masks at all time, both to protect themselves from potential infection, but also protect others from being infected through their contact with the healthcare system. We have some of our providers in New York right now, sort of on their days off, trying to help out. There has been an influx. I mean, rather than trying to keep people out, what our governor recommended was to quarantine for 2 weeks and make sure that people know that, and that is being enforced on the borders on both sides. Also, Massachusetts has similar orders. There was less of a discussion, I think, within the group coming from Mass, whereas Gina was kind of more publicly quoted on that. But I think it's also sensible on both sides. If I were in New York and I had another option, I would probably try to take up my other option. Likewise, just in terms of flattening the curve, keeping this from being more widespread, if that's at all possible, is really important. And so being very strict on people's public interactions is really, really important.
How do you feel walking into the hospital every day?
It's a mix. If I've had a couple days off, I start looking at the news before I go in and looking at my emails and trying to be caught up. And that is anxiety provoking once I'm in the hospital. This is what we train for. We are still in the early stages where the number of patients we're seeing is increasing. I would say the most disturbing anticipated part is when we're taking care of our coworkers. That's happening on a low level now. That undoubtedly will increase. And I think for our staff in the emergency department, where we're used to people being very sick and dying, that part is expected and we've trained for. Seeing our colleagues ill is something we don't see on a large scale. And I think that's still the unknown for our group of how we will react to that, both short term and long term. That's definitely the biggest X factor. Yeah. But when I actually go to work, I feel like I can do something. So there is that freedom that I know a lot of people right now are struggling with when they're at home, right? Is that they feel powerless, and their power is in staying home. And that's an active practice of reminding yourself that doing quote unquote nothing is doing something right now. And in some ways in the emergency department, we have the benefit of being able to be actively doing something, although there's not a lot we have to offer with this infection.
Well, with that said, so are you sort of just managing people's, I mean, what exactly is happening? I mean, if they have it, they're just sort of in a hospital bed and you're managing their care. I mean, is there anything you can do for them?
I mean, we can treat their symptoms. And I mean, I think this is just important for people to know. I think a lot of people do know this and aren't accessing the emergency department as much as they might, even for flu-like symptoms, because the biggest thing is symptom management. If you can symptom manage at home, that's the best place for you to be. Our main job in the emergency department is assessing acuity. So trying to assess whether a person is heading in the better direction, the stable direction, or getting worse. And so really trying to catch those people who are kind of falling off the curve from an airway point of view, from hypoxia. And that's definitely the biggest thing. Like if you are short of breath, that's when you need to present to the emergency department. And certainly if you're hypoxic, like if your oxygen is low, those are the people that need to be in the hospital. Otherwise, most people are getting sent home with symptomatic care. We're giving people fluids, we're giving people pain medicine, we're giving them nausea medications and things like that. Assessing for pneumonia, but most of the time, even the pneumonia is a viral pneumonia, so you don't necessarily need antibiotics. So it's more supportive care. But it's the assessment part that's hard. And there aren't many, at least I don't know how it is in California, but most of our doctors' offices are doing telecare if they're even open. And so they're not able to do that assessment process very well over the phone. So a lot of people are getting referred to the emergency department for us to take a look at them, put eyeballs on them and say, you're okay to be home or you're not. And we're trying to be very careful as much as possible to make sure that the people that do come in are as safe as they can be. But if you don't have to be in the hospital, it's certainly not the place where we'd want you to be.
Yeah, that's definitely been a challenge on our end doing telemedicine. There's only so much you can do. You can't do a good lung exam. And so that's been hard. But when patients do come to the ER, are you guys triaging them outside in tents and doing that sort of thing that we're doing here? Okay.
Yeah, and we have different areas in the emergency department where COVID likely patients are placed as opposed to other complaints. Is that triaging process perfect? No. Certainly people end up spiking a temp in the COVID unlikely area and then get moved to the COVID likely area, and vice versa. There are people who have a temp or some other symptoms that are generally falling within the category of potential COVID patient who don't have COVID. We have, just in the past 2 weeks, we've put in special vents in the COVID likely area, where which act essentially like creating a negative pressure room, kind of a safer place for where there might be viral particles circulating, and a special kind of ventilation system so that that whole treatment area functions like these negative pressure rooms, which used to be the standard for where we place high-risk patients, and there just aren't enough of those. So now we're creating kind of whole cohorted areas where the venting system should, yes, kind of filter out those particles as much as possible.
Yeah.
What if someone, I don't know, I was just thinking, like, if you need to go to the ER for an unrelated COVID situation, are people, obviously they're still going to the ER if you break an arm or you need stitches, or what's happening there? Are they just directed in a different part of the building?
Mm-hmm. Yeah, so they are directed in a different pod in the emergency department. Yeah, and people are wearing, all the hospital staff is wearing protective, like everyone in the hospital is wearing masks and have been for 3 weeks or more, on the assumption both that anyone could potentially have COVID and also including our staff, which is certainly true. So just trying to limit in the same way, I'm not sure what you guys are doing, but in the past week, there's been recommendations about, wearing masks or scarves in public, just when you're outside. And that's, we've been observing that in the hospital, for, basically the month now.
I know that
you can't really see anyone. You can't recognize your coworkers anymore because you can just see their eyeballs.
I know you do a lot of mindfulness at the hospital and teach mindfulness to people that you work with. Mm-hmm. Have you just been on complete overload right now, or are you sort of taking a breath?
No, I feel like personally, my, spiritual practice is all the more important, and it's just clear. Sometimes you can kind of get caught up in things and let it go. I think right now, whatever it is that people do to ground themselves becomes all the more essential. And if you don't, as your day goes on, it becomes pretty apparent, like, oh, I can't do that again. And for me, it's mindfulness practice, for sure, is like the staple of my day. But so is exercise and eating good and sleeping well. And I feel like for everyone, but particularly for people on the front lines, doing all those things you do to keep yourself grounded, healthy, and sane are all the more essential. It's just important not to make it another like to do, because, oddly, and I think lots of people are experiencing this, not just people who are, working in medicine, but we're certainly busier, even though maybe the clinical volume is lower. Everything is more cumbersome. Everything is more challenging. Most of us are dealing with either caring for someone else full time that we weren't before. And so all of those practices become all the more essential. And you need to make them maybe more condensed so that you don't create like I'm going to cook fresh bread and I'm going to make 3 meals a day and I'm going to homeschool my children and somehow still work full time. So how to kind of balance that, and just with a lot of levity, humor, and forgiveness, like self-forgiveness of that our lives are not supposed to necessarily look more organized and more together during the time of a pandemic than they would on a day-to-day, and certainly mine does not.
That's a very good point. Yeah. Do you, so what do you do? Are you, you sound, obviously you're extremely busy. Where are you finding the time in these moments throughout the day? Do you take like little mini mindfulness moments at work, or is it in the morning or in the evening, or how do you kind of build it in? I imagine you've been doing it for a long time, so you've got it dialed in.
Yeah, I mean, I do think I'm very grateful. I've just resourced myself in a lot of different ways. Mindfulness is one part of one part of that. But I'm very grateful to have those habits already. I'm also a big believer that like less is more. So even a little bit, for me, first thing in the morning, works better before I start getting too busy in my mind, before I start, creating my mental to-do lists and everything like that. And I've been pretty deliberate. Like even this morning, I had a lot of big to-dos and I was like, no, sit first. Just don't think about it. Don't decide what to do. Um, uh, yeah, and it's like maybe a silly thing or probably certainly a first world problem, but like I have someone who comes and helps clean my house, and right now my house is a disaster, and I was debating whether or not to have her come, both trying to weigh up what her own sense of insecurity and her sense of like financial need, and her wish to help, and how to do all that. And she was supposed to come this morning, and I thought, no, sit first. And then at the end of that process, like if I just set it aside for a minute, at the end of that process, I had a plan for myself that actually worked really well. For her was a time for her to come when I was not in the house, and called her and to see what she wanted to do, and just trying to like, those kind of little things. How do we keep having some structure, some order, do those things that make us feel sane, but also in a way that's kind and considerate for others. And for me, I need to do that by taking a breath first. And that could be a minute or 5 minutes.
Yeah, that's a good point. How do you see us coming out of this? How do you think it's going to change us in medicine and as a society? It's a big question, I guess, but.
Mm-hmm. I mean, I think one silver lining I see right now is that that people are nourished by integrity, by validation, like just by speaking the truth, and just kind of acknowledging that this is hard, and that kind of inspiration and leadership, I think, is really helpful. And I hope it's going to stick with us. Like an appreciation of it really does matter. Those qualities of being a little kinder than necessary really, really does matter anyway, and certainly in time of crisis. And so it's very inspiring to see a lot of people double down on kind. I think there is some value to needing to find grounding, and I think everyone's feeling the need for that, and a lot of people are seeking it out. So that's also potentially a benefit that we can have, that we can move forward with. Appreciating the people in your life that you maybe can't see as much as you want, but then you try to get creative and figure out how you can see them. I think it may make us value personal connection more. Personally, from a healthcare point of view, I hope this makes us look at the sort of fallacy of our healthcare system, where we both promise that we will take care of everyone for the public good, and we don't actually, that's not actually how our healthcare is set up. So I hope that there's some understanding and reckoning of that over time. I think that's going to be a long process, and there's going to be a lot of fallout. I mean, the emergency department, for example, most emergencies departments through the course of this will be bankrupt. That's just true. We have less volume. We have to staff for emergency reasons. Our department's fairly well off. We will have a very hard time financially surviving this process, and that's going to be true. If it's true for our department, it's true across the country. And we can't, as a country, afford to let all of our emergency departments go bankrupt. So we're going to have to look at that. In terms of how do we come out of the actual acute viral infection process, I think it's going to be a long haul, on the order of weeks to months before we're able to, quote unquote, go back to normal, whatever normal was. And I think it's going to be a slow pullback where, we've been closing things more and more. It's hard to imagine what else we could close at this point in time. I know even just like our public bike paths and those kind of things just got closed yesterday, which is really hard for a lot of people. And I think the lessening of those restrictions will also happen very slowly. It's not going to be like 1 week everything comes back. It's going to be 1 week you can go back on the bike path, but you can't go to the public parks, and like that. It's going to be slow, and that I think that's going to be hard for people because here it started off in March, which is still cold, and now it's April and it's 60 degrees outside and gorgeous, and that's harder for people to contain than it is when it's cold and wet. So each day it gets a little bit harder for people to hold these restrictions, and I think we're in for the long haul.
I couldn't agree more. Would you be able to lead us in a little meditation or guided meditation exercise?
Yeah, absolutely. Sure. That's a nice way. I mean, you'd asked that question earlier of, how do I fit it in? When do I fit it in? I also try to remember or take opportunities throughout the day. In particular, like when I'm working clinically, if I see a patient that particularly moves me, I try to, send a beneficial wish their way, aside from just trying to help them, and just using them as a reminder, almost like a placeholder in my day of like, oh, you're reminding me to go in. So yeah, I just really appreciate the reminder to go in.
Good.
So I always generally close my eyes to kind of decrease distractions. If you're feeling particularly tired, keeping your eyes open a little bit and letting in some light can be helpful. And generally just try to sit in a position that both promotes alertness and relaxation. It's easiest if your back is straight but relaxed. And recently I've been focusing on a meditation where you let go of all your gross thinking minds, the stories, the worries, the anxieties, the fears. And you imagine that you are like an inanimate object, like a stone or a block of wood or a computer that's been shut down. And in this way, just allow yourself to disengage. And more importantly, to allow underneath those busy minds a more peaceful, calm, subtle mind to become more apparent. So you can think a stone has no worries, does not need to plan, does not feel overwhelmed or distracted. A block of wood is not afraid of illness, does not feel alone, does not get bored. A computer that's turned off doesn't continue to process. And as you absorb into the cessation of our normal, everyday, distracted thoughts, you may become aware of a place of deep peace. Where we don't think about the future or perseverate about the past. Where we are safe, centered, loving, and wise. Where we can connect with our best self. And where we are connected to the potential of every living being around us. To be peaceful in a storm. To be kind, even when in fearful conditions. And finally, we can wish to recognize this place in ourselves and in all others as we go about our day. And you can relax your meditation now.
Thank you, Laura.
Yeah.
Thank you so much, Laura. We really appreciate you taking the time today, and we wish you to be safe and well out there, working so hard for all of us and for all of your patients.
Thank you all for your work and all your work on behalf of all the different patients and clients you help. I think people nourishing the beneficial connections they have right now, and you know, I know you guys are so close to your clients, and giving people a little perspective and kind of a deeper information from a trusted source is so helpful for people because they're just overwhelmed with information and they don't know where to turn. So it's very kind. Thanks so much for having me.
Thank you.
Thank you. Please stay safe.